Okay, so it says you are beginning your shift. Supervisor. As a supervisor, I wish you have decided to fill in for a team member. Um, you are monitoring the emergency department. You are asked to assess a patient who is currently being admitted to the ER. 55 female, complaining of general weakness and fatigue. What would you include in the evaluation? So let's look for level ones. First thing on the list is Babinski. No. Second is urinalysis. No. Third is MRI. No. Fourth is symptoms. Yes, let's do symptoms. Weak generally, difficulty seeing, and an inability to swallow. So there's a more difficulty seeing. Next on the list, you have cerebral perfusion study. No. Let's get the vital signs. Rate 18, heart rate 97, temperature 98. Okay. Heart rate and breathing's a little bit fast. Three. Get for vital capacity down. I like to find like the height and weight and put it like really close with tidal volume and vital capacity. Okay, so I'm gonna skip the vital capacity for now. Chest X-ray, that's level 3. EMG, nerve conduction study. Want to do that, but that's a level 4, really. I know I'm trying to do all the level 1s first. ECG, there. Barium swallow test, tempting but no. Spinal fluid analysis, tempting. But for thoracentesis, general appearance, yes, let's do that. So the patient is 5 feet 4 inches tall, so the height and weight is in here in the general appearance. 5 feet 4 inches, 163 centimeter tall, and weighs 238, which is 108 kgs. Color is good. Of which disease, and her daughter indicates that the patient's face appears to be droopy, so that indicates a disease, a certain type of disease. So that's a clue right there. Alright, so now it's 400 medications. Takes a ACE inhibitor, enalapril, a drug with the word April in it, April, enalapril, Vasotec, so I'm thinking that's a vasopressor or something like that. She also takes Lasix, furosemide by mouth daily. So that's all the level 1s. So is there an emergency? I would say not, so I can go to level 2s. Do we really see any level 2s? Level 2s and stuff. So can we go to level 3s? Yeah. No, I'm not gonna do that. ABG, yes, I'm gonna get her ABG. Am I really supposed to even get all these levels of an assessment on her initial in the emergency room? No. Should I get that? Okay, let's get it. Clear. EMG, ECG, swallow test, Baird swallow test, spinal fluid analysis. I don't know. I'm gonna go to the next section. Forget any of that. Okay. Immediately after assessment, give report to the doctor. Doctor asks for your recommendation concerning confirmation of a diagnosis. What would you recommend? The options are to perform plasmapheresis, check gag reflex, peak flow, administer that, and hydrophonium. So I'm gonna do the hydrophonium because the drooping should have indicated certain type of disease, you know, MG. Then it says after preparing a crash cart and placing it at bedside, the drug is administered to the patient, hydrophonium. Soon after, patient reports that she's better, able to swallow, in general feels stronger. Doctor suggests patient is experiencing a myasthenia crisis and decides to admit her to the ICU for further monitoring. He asks you to create a list of care plan ideas for the patient that he may present at a multidisciplinary care council. You will include which of the following on your list. Okay. So the options are to order bed rest with no ambulation. Can do that. Further down. Low dose hydrophonium intravenously. It's a diagnostic drug. It's not a treatment drug. So that's a no. Discontinue the Vasotec and Enalapril. I don't know what that is for, so I'm not sure about that. Monitor vital capacity, tidal volume, MIP. So I'm definitely going to do that. Perform an initial bedside PFT. Yes, let's do that. Obtain electromyogram. I think that's for the muscles, so let's do that. So I really don't know. I'm just going to choose some stuff, yeah. Schedule a helium dilution study. No, I'm not going to do that. Install trach. I'm going to choose that, but I don't know how long she's going to be out, so I'm not. Administer low dose caffeine intravenously. I think they only do that for babies. Yeah. Begin a daily course of dialysis. I don't know about that. Obtain a CVC. Yeah. Let's go to the next section. So now it says later, the patient remains in the ICU. Her urine output is being monitored and is found to be 40 mLs per hour. She has had 2 doses of mestinon. Blood pressure is 132/85. Temperature is 36.4 degrees Celsius or 97.6 degrees Fahrenheit. Auxiliary. An assessment of the patient also reveals the following. A heart rate is 98. Tidal volume is 390. Vital capacity is tinted and less relief in spite of the medication. She asks if she can receive more medicine. What would you recommend? Increase the mestinon dose, reduce fluid intake, administer normal saline. Intravenously intubate and begin of that. Continue close monitoring. I'm gonna either or close monitor, but she already had 2 doses by mouth. So dosage increased from 60 to 80. Okay. So during a routine assessment 8 hours later, her vital capacity is measured to be 1.8. Tidal volume is 390. MIP is negative 20. After John call. 2 is 92% and 3 liters. What will you recommend? So she's still breathing adequately. So would you give her an increase in oxygen, intubate her, begin NIPPV, administer dopram, perform nasotracheal suctioning, continue to monitor? I'm gonna just monitor. Physician agrees and also orders nothing by mouth for the patient. Okay, because she can't swallow, right? So a few hours later, her vital capacity is 0.9, so she definitely needs to be intubated now. MIP is 22, negative 22, SATs are 92 on 3 liters. Patient maintains an ability to follow commands. She indicates she's hungry. What will you now recommend? Will you begin NIPPV or increase her intake, place the patient on a non-rebreather mask, begin invasive vent, or continue to monitor? I'm going to begin invasive vent. Just done. Okay. So doctor requests that you recommend initial settings. So I need to do the calculations for her based on her predicted height and weight, but me, I don't know how to do that. So she's 5'4", 163 centimeters tall, and weighs 238 pounds, which is 108 kgs. So I'm gonna say 63, right? So is this an emergency? 100%. Does she need 100% oxygen? She's on 3 liters, right? She's starting 92 on 3 liters, so she doesn't need 100%, I don't think. So back to volumes now. We have a 50. The last option here is 45, 400, 14 is the rate of people 5. That sounds kind of good if I know what exactly her thing is. Or the last one, which is 500. I'm gonna do, because she's 163 centimeters, I'm gonna do 63 times 5 to get the minimum. 3, 5, 15. Put on the 5, carry the 1. 5 times 6 is 30. 1. 310. So I think the 14 and the 16 will work. I think these two will work. But I like this one better. Physician disagrees. So let's try this one, 400. It's probably too low. But he agrees. Okay. Okay, so 5 days later, you are again caring for this patient. During your vent check, you discover the following: spontaneous tidal volumes of 400, and vital capacity is 3.8. MIP is negative 42. Dynamic compliance is 22. Spontaneous rate is 16. RSP is 40. Patient appears properly oriented and responds appropriately to commands. What would you recommend? So basically, she's good. She needs to get off. So It says discontinue vent, start spontaneous breathing trials. She don't need to do that because she's over her worst. So place the patient on SIMV. Could do that, but I think she's like a fast-tracked wiener. Wiener. So I'm gonna just disconnect and okay. I hope I pass. I deserve to pass. I should pass this one. Deserve. Funny. And it says I got a 94. Pretty cool. I did really good. I just missed one thing. Or I got one thing wrong. Okay.